Hello, welcome to Steve and Diane on Alzheimer's. I'm Steve,
I'm Diane.
and today we are going to talk about what, Diane?
We are going to talk about taking care of a caregiver.
That's
In
kind of
this
the topic
case,
of the show, right?
it is kind of the topic of the entire
What
show.
kind of
But
caregiver?
rather than talking about taking care of a person who has Alzheimer's, today we're going to talk about taking care of the person who is taking care of the person with Alzheimer's. In this case, it would be our dad.
Yeah. So many of you out there are, this happened to my significant other, and you find yourself in the role of being the sole caregiver. And then there are other people, supporting characters, in the
Family
situation,
members, right?
Steve and Diane, as the
Right.
son and daughter of, and we have to look out for Dad and see what are we missing? What is he missing? Well, how can we help him out?
And recently, of course, that became even more important as our mom passed away a couple of weeks ago. And knowing how to take care of our dad, who spent every afternoon at the nursing home with our mom, it is a little challenging right now, and knowing what he needs and how to support him in his grief. So
It was 3 years, so just to put that in perspective, for the last
that she was in the nursing home.
3 years, his mission every day, he would get up,
Every
just
day.
like going to work. He would go to the nursing home. What was the nursing home? Assisted living and
Memory care facility.
Memory care
right.
facility, yeah. It's all hard to call these things what they are. And he would hang out with her for
Most of the
probably
afternoon
from
and
noon
through
to
supper.
6, and yeah. So he would be with her, sit with her, take care of her, and work with staff and talk to people. And he was the eyes and ears of that facility, and he really got an opportunity to get to know a lot of these other folks. But what we started to notice is in the beginning, before Mom went into the memory care facility,
And even before her diagnosis.
yeah, there was a cooperation of both of them working together to just do, this is her job and this is his job, and that's the way their family structure went. And she would cook and she would clean pretty much inside. He would do the outside chores and most of the maintenance stuff around the house. Car, yeah, you'd always take care of the cars. Yeah, she liked taking care of the cars, and those types of things. And so when it came down to the fact that Mom couldn't do her role anymore, he struggled because he didn't want to admit, I don't think,
Right.
very easily, that she couldn't do his job. And then I think we said it before, a couple of times we'd have Thanksgiving, and Thanksgiving turned into Kentucky Fried Chicken. And we were trying to figure out
And
why.
tacos.
Yeah.
It was always an odd combination of things. And
I don't mind the tacos, but
Right.
yeah.
Tacos are good.
Yeah, but that was just kind of the very beginning, and just to pay attention to what a primary caregiver, should we call it that? That sounds like a primary care physician, but the primary person taking care of the patient or the person with dementia. Somebody's got to look after them and pay attention to their needs. So what things did you notice, like in the very beginning, that we struggled or maybe noticed and had to pay attention to?
At the very beginning, Dad was kind of in denial that anything was going on, so he was trying to cover. And anytime we would question the ways and methods in which he was covering, he would kind of get mad at us because he did not want to believe that anything was wrong with Mom at all.
I didn't either.
That's correct.
Yeah.
So the times that I would question what was going on, everybody would get mad at me. But some of the things that we would notice, like at first, some of the unusual types of foods we'd have for holidays. But then after a while, we noticed, and even you noticed, that they were not eating very nutritious meals, if any meals at all. They were eating a lot of snack foods. They were eating a lot of like popcorn and peanuts and cookies and stuff, and then maybe once a day they would go out and get some kind of carry out and bring it home. And they used to kind of go out to eat a lot,
Yeah.
and that really stopped.
They did.
And-
They're their favorite places.
Right, and they would still get some carry out, but they would mostly go like to drive-throughs and stuff, and I think it was getting harder for my dad to kind of take my mom places and you know, kind of keep her safe and keep her listening, and then he would have to juggle kind of the sundowners time frames too of when she would feel not herself. And so he started to just basically maybe one day a week, I mean one time during the day, get some kind of carry out. So they were eating fast food and just snacking the rest of the time.
Yeah.
And the refrigerator would not have very much groceries.
There was a lot
in
of
it.
stuff in there that you found and started to point out that was expired and that was old and got
Right.
nasty, and then once you started saying that, we all started to check on it, and we
Right.
would throw stuff out that shouldn't be
Just
in there.
throw stuff out because it would be scary if they had eaten it, right?
Mhm.
So that kind of became one of our jobs. Whenever either of us were over at our parents' house, we would kind of quietly go through the refrigerator, not really make a big deal of it, and just kind of get rid of some stuff that was too old, and look through the freezer too.
Mhm.
And
You can just wander around the rest of the house and just keep an eye on things to see what is out of place, what doesn't make sense.
Or, you're right, does the floor really need vacuum? Does are the bathrooms clean? You know, how is that kind of situation going? And help out wherever the need is.
Is laundry
because-
building up?
Right.
Why does the house smell like pee? You know, and sometimes that was an issue, and
Right.
she
That was later, but
much
definitely.
later.
Right.
Yeah, so there was lots of things to look at that point, and then once we got her into the memory care facility, then of course Dad was suffering with not getting the proper nutrition, and then you
That was
really
even
does.
before, they were on, when we noticed that they weren't really eating, I called Meals for Wheels and said, hey, please start sending,
She was
you know,
there.
2
I'm having trouble
meals.
remembering myself.
Right,
She was still at the home.
Yeah,
The house?
yeah.
Okay.
yeah. So please start sending 2 meals to their house every day.
It was 3 years ago.
And my dad hated that, was mad at me for doing that, but I started it. I even told Meals for Wheels I would pay whatever their donation is, which it's very inexpensive. They come every day. They send someone who knocks on your door and will call one of the family members if no one answers, and they will bring a meal that can just be microwaved, and it's always got some kind of breads and fruit also, and milk, and sometimes
Meat.
juice, usually juice. Really nice meals in our
Yeah.
experience. And
It's
the
impressive.
best part is they send people who will stop and talk to your caregiver person and your person with Alzheimer's, or whatever reason people need Meals for Wheels. It's not just for Alzheimer's. But the companionship and the fact that someone was out there every day checking on them.
Yep, keeping an eye on them.
And I mean, my dad, we didn't realize how much my dad was missing socializing with other people.
Yeah.
And having these other people who are of a similar age, or even in other cases younger, come. Sometimes they'd bring him some cookies they made, or they'd bring both of them some card that their children colored, or flowers. Sometimes they'd bring flowers, and it was just this touch with community that he so needed, because he and my mom had become so isolated because it was difficult to take my mom out in public or in other situations, and it was really a great thing. And
Yeah. No.
I am so grateful for all the people in Meals on Wheels who
Yeah.
came and still are coming, because he still needs fed. and he's not real great at that. So
Yeah, these people are truly heroes. You know, you hear
yes,
people say
very
that,
much
but
so.
they have pages of notes on him, and everybody would know his name, and he has a Corvette, and he's super proud of his Corvette, and he loves to talk about it, and they all know about it, and they come and, hey, let me see your Corvette, and show it to me, and not just, here's your food, have a good day, is everything okay? You know.
And they would ask him about Mom every time,
Yeah.
and they would bring special treats for her,
Yeah.
for him to take to the nursing home when she was gone and at the nursing home.
One of the very most touching things that I've seen recently is they got a card for him once they found out, and every single person in the whole
Right.
facility signed it. There were probably 50 names on this card, and they all, you know, were so sad and sorry to hear about her passing, but they all wanted to make sure that he knew he wasn't alone, and every time they come and show up,
Right.
he tells us about this adventure and this story and this interaction and this community
Every time.
that he's had
Right.
with them. So this means so much to him that I'm sure he knows, but you know, it means probably a lot more to him and his journey than he
Right.
probably even recognized.
Right, one of the best things that we did.
Mhm.
And we know that every day he's getting a great meal. And a lot of times they'll bring extra, or they'll bring some extra for the weekends because they don't come
Mhm.
on the weekends, and they just kind of look out for him.
Absolutely.
And give him someone other than us to talk to. And that's been such a blessing.
Hmm. Yeah, they're super nice and I don't know, they're great. So I can't speak
Right.
enough.
Thank you,
know,
Meals
yeah,
on Wheels
thank
people.
you so much.
Anyone out there who is a volunteer, thank you.
Mhm. Absolutely. So that's a great thing to think about. Look it up, Meals on Wheels. Like Diane
Almost
said,
every community
Mhm.
has an organization.
I hope they're as good as this one out
Yeah,
here with us. But yeah, so that was a great thing that really helped us to take care of our dad through proper nutrition. And then on
and
the
Mom,
weekends,
because she was
yeah.
getting the meals
Mhm.
too, and she loved them, so.
Yeah.
Eating was always one of her favorite things, so.
Mhm. Yeah, she didn't get. Never mind, I won't go there. But yeah, so food, we got that taken care of. That was
Yeah.
a huge thing, and to a large degree, that community, you know, getting out there and talking to people,
Right.
because his whole life became consumed by taking care of her, and
Right,
you know, and
and he was in survival mode, he was in, you
Mhm.
know, not getting enough sleep, and, you know, that was one of the other things that we needed to kind of help
Right.
address.
stress levels were always at 11
Right.
out of 10, because he would never be sure at home when she was there what would show up, you know, what personality would show up, and so he had to pay attention to that and be very careful, and even just what time of day or what time of night she would wake up. She would really like to walk and wander
Right.
in the wee hours of the night, so he wasn't getting sleep because he was always sleeping with one eye open kind of thing.
Right, and
So-
having to keep the doors locked in a
Mhm.
way that she couldn't get out if she did wake up when he didn't wake up.
Yeah, for
So
sure.
after the whole Meals on Wheels things, one of the things that we needed to do was figure out how to give him a break from caregiving.
Mhm. Yeah, and you really helped in the beginning with that, saying,
Right.
hey, bring our mom over and I'll hang out with her for a couple hours, and
Right.
then he could go to the grocery store or drive around or just probably sit and think about what she was doing more often than not. But
Right.
sometimes he would even stay.
Right, a lot of times he would stay, so probably 2 days a week, I would have Mom come over here,
Mhm.
and she and I would hang out, and my son, and we would watch videos. I had some videos of the kids when they were little that she absolutely loved, and almost always we would watch those just because they were, she would talk to the babies like they were
Mhm.
there, and you know, it was really nice for her. And
That's an interesting observation. A lot of the
right,
dementia patients have an affinity to little babies or little baby dolls.
very much
and
so, right?
and-
Or dogs,
Mhm,
puppies,
mhm.
little-
Yeah, give them
little
puppies,
snuggly
give them
things,
little dolls to hold and play with and cuddle,
Right.
and that
I
gives
love
them
that.
such a reassurance. And so if you're struggling with fidgety or moving around, if you put a little doll or a toy and
Stuffy, yeah.
stuffed animal in their arms, that may calm them down a little bit. So just throwing it out there.
Right.
But yeah, so that was good. So we bought him some time just to calm down and collect his thoughts, and if he wanted to go take a nap, he could go take a nap. And
Right, or go to the grocery store, or, you know, take care of a car thing, or whatever it was he needed to do. A lot of times he would stay just because, you know, he didn't know what to do.
yeah,
But most of the time he would take the time. You
yeah,
know, and go back even to the house and just, you know, feel like he wasn't responsible for a period of time. And then on the weekends, you would take over. You would always go over there on the weekends and either take your kids or just go yourself and give him some chance to just sit and talk with you guys, or another chance to go and get groceries or do
Yeah.
whatever.
yeah. Big distractions, you know, in
Right,
a good way,
right.
but to
Right,
get his
in a
mind
good
off
way.
things and
Right.
to interact with mom a little bit more, and bring the kids over so they could have a chance to engage with her while they could.
Right.
And she loved that. She lit right up, and she would color with them or do whatever.
Sure, play Connect Four,
yeah,
you know, pretend to
yeah.
play Connect Four,
Mm-hmm.
or cards or whatever, you know,
Yeah,
coloring,
all that was really good.
listening to music, yeah,
Mhm.
all of those things were things that she could participate in, that, you know, we could all do.
Yeah. Recently, it's kind of, it's not quite recently, but Dad would say, hey, I need to go here or do that. And there might be like a shop or like Menards or something like that, or and he'd want to get a little further out, and maybe wanted to get some like we just went out and we both needed gutters and some gutter guards, and we needed some gutter repair. So we went out and just spent a couple hours at Menards just wandering around looking at
Right,
stuff, and
that's what he needs, right, he
And-
just,
mhm.
right,
that was a great distraction. And we got some stuff, and then he's like, hey, if you want me to help you do that, let me know. So he came over and helped me put a couple gutters on, and that was really good. And I got some in, and I'm a very visual learner, so once I saw and had a little confirmation that it was done right, then like it was easy to fix the rest of them up. But then I'd go over to his house, and we'd do it at his house,
right.
things like that. So yeah, just paying attention to what he needs and find some distractions for him. And work is such a great thing. So you know, we could get into some of those tasks that he would want to do, and you have to be a little careful because he still wants to feel like he can do anything.
And he's getting older.
Yeah, he's approaching mid-80s.
Right.
And so I don't really like it if he wants to climb up on a ladder and things like that, but
Right,
and anything.
but no one else is there,
Yeah,
especially.
right. And yeah, I think he's okay with that now, but hopefully, right? And so he'll have some chores that we'll need to do, and we'll help him with that. But then we had to pay attention to, because every time he wanted to do something, I think it's just in our instinct just to say, okay, we'll help you do that, or we'll do it. You
Right.
just sit here and relax. But the point is, he wants to feel validated. He wants to feel like he can do stuff still.
And he needs some things to do,
Mhm.
yeah.
So he had this big job. He wanted to redo his whole garage and put siding up in his garage, and
Paneling, right,
yeah,
Yeah.
paneling, not siding, right? Paneling. Thank you. Put paneling up inside the garage, and something like Lisa could help him with, or you know, I can help him hold things
Right.
up, and we can hammer things in there and do whatever we got to do. So we're like, hey, we can get in there and knock it out in like a day. And he was like, nope, I think I need to do this. And
right.
it took him a couple weeks, and it looks really good, but he did it all himself. And
Yeah, he did a really nice job, and it was funny because it took us, probably 3 or 4 times to realize that he doesn't really want us to help him.
yeah,
Which is so funny because we kept both saying, well, when can we go over there, and when can we get this job started, or whatever, you know.
right,
But what he really needed was, you know, he needed a little bit of help moving some cabinets. He couldn't have done that by himself.
yeah,
And other than that, you know, he really needed to be able to accomplish something like he used to, and feel like he could. And it was a very powerful thing for him. It was great.
yep.
And it looks really nice.
Yeah, we went out to Menards, and he ordered all his paneling, and
Right.
they delivered it, and
Yeah.
yeah, he was pretty good. Every once in a while he needed an extra hand or two, and I think
Yeah,
your son helped him out with that a little bit, and I
right,
know we helped him.
right,
a
you
little
guys
bit.
help too, yeah.
But yeah, he did a great job. So just recognizing you gotta feel validated, like you can still do
To
some
feel
stuff.
capable, I think, yeah, yeah.
Mm-hmm. It's still good.
And that there's more to him than just taking care of someone.
Mm-hmm.
So it was a good thing.
Yep. What else was there?
I think when you were talking about Menards
Mm-hmm.
and about going and getting the paneling and stuff like that too, I think one of the things that he quickly lost when Mom's Alzheimer's got worse was he lost that person that he bounced everything off of. And I don't think either one of us realized how much he did that.
Mm-hmm.
You know, I don't think he made very many decisions without talking to my mom about it. And, you know, he comes off a little bit as, you know, the kind of guy that just decides everything, right?
Mhm.
And I don't think that that was really the case. I think he talked everything over with Mom. And for a while, actually, for most of the time, I'm sure he does this with you too, but he calls me almost every day, and he'll talk to me about the news, and he'll also talk to me about whatever decisions he's got kicking around, and I know it's just because he needs to bounce them off somebody, and I don't often say too much. I let him talk, you know, and let him do what he needs to do. And sometimes, because I think that's what he needs, you know, but no, sometimes he's just like, just tell me what I need to do, you know?
Yeah.
So, you know, trying to help with that part is important too. You know, they're missing, I know my dad was really missing that part of my mom that you know, he talked to. And
you're a team, and it's good
yeah,
to
and they, I think
balance
they
this
were
out.
a team, more so even than I think I knew, you know,
Mhm.
because Mom was a little more quiet, you know,
Yeah.
and yeah, I think Mom had her hand in everything, and
Mhm.
you know, I kind of think I missed a little bit of that, and now
Mhm.
that I see how Dad is responding to it, I think, wow, they really had a deeper relationship than even I thought, you know.
Mhm.
So
Yeah. Well, that's good. I find myself, as we talked about that and started to think about that, I look for that in my spouse.
sure, of course,
my wife.
right. I would miss that so much.
Mhm.
You
Yeah.
know, of course.
I want to do this. What do you think about that?
Right, right.
Yeah.
About even the smallest things, and
Mhm.
you know, I know Dad sometimes needs some reassurance that it's okay to call me every day, but it is. I'm okay with it, you know, being a little bit of a sounding board for him,
Mhm.
and sometimes if it's just not my thing, I'll be like, you know, who you should talk to about this? You should really talk to Steve about this.
Thanks. Now I know where I get it from. Where I get it. Right.
But it's true, you know, there's some things, you know, like that you're just more suited to, you know. So
And that's kind of funny too, because
especially about healthcare, or some of the healthcare
Yeah.
things about taking care of Mom, you know,
Mhm.
we're way more you than me.
yeah, I try to that, and his healthcare too.
And his
Obviously.
healthcare too, right? Exactly.
So that's another thing to think about. You know, we use a lot of the hospital systems around here use Epic, which is the electronic medical record, and it has a cool little app called MyChart, and you can download that, and he can get all his results on there, and then I am his proxy, so he just requested that I also have access to it, so whenever his labs come in, I will get a notification and I can see them, and we can have conversations about what his lab results are, and I can translate that, and that's great. And then you can pay your bills, you can set up appointments, you can set up reminders, and it's a really powerful tool. I sound like I teach it because I do. So,
It's true.
that is not a commercial for Epic, but that is my job. So,
But noticing
mhm.
what healthcare issues the caregiver of the person with Alzheimer's might be having is super important too, because
they don't
when they're in
time, they
survival
forget.
mode,
Mhm.
yeah, they are not thinking about, oh no, I need to go to the dentist, or oh no, I need to go take care of whatever, or, you know, why is my stomach not feeling good, or whatever. So keeping a special eye out on them and their healthcare issues
It's
is,
huge.
yeah, huge,
His
and
dentist-
encouraging them
yeah,
to go take care
The
of it.
dental thing just came up, and we had a lot of issues with that. And he still has to get, I think, by neglecting his teeth, there might be endodontal work ahead of him and things like that. And just when I go to the dentist and get a cleaning, I'm like, can you just reach out to my dad and just say, hey, it's time for appointments? I'll mention it to him. But if you call him and try to set up an appointment, that might be very helpful. You know,
Right.
'cause he will say, oh yeah, I'll take care of that, or I've got to take care of that. And then you get distracted and
Well,
survival mode, and you're
right.
not thinking about that. It's the last thing until it
Right.
hurts and until there's a problem. And that can lead to infection, and infection can lead to different choices. It can affect your brain, and it can affect the decisions you make. So all those things are really a big issue. So if you can pay attention to those, just keep an eye on the caregiver of the
Right.
patient, then
And the part of all the things that they're putting off, because
yeah.
when you're focused on watching someone you've spent 60 years with go through Alzheimer's, you don't have a lot of other energy for anything. So there is so many times of, well, I'll get to that, or oh yeah, I gotta do that, or, you know, I really need to do this, you know, his hearing is starting to fail, and that is another thing that we would very much like to, you know, help follow up on with him, because that just makes it very difficult for, you know, him to be part of everything, you know, when he can't quite hear. It's not too bad yet, but it's something that we're watching. And
it's an interesting thing, if I can add to that. Sometimes people can't hear, and they are too proud to admit that they can't hear.
exactly.
And they will say, oh, okay, yeah, or this or that, or they'll just start talking over you, and it seems like they're rude,
Right.
and it doesn't make any sense at times. It's like, why aren't they listening to me? He's not, you know, and you
Right.
feel that, and the real problem
Right.
is he can't hear. And so,
Based on how loud the television is when we go over there.
oh my gosh,
He's
yeah.
definitely having some issues, and I think he's covering up, you know.
Mhm.
I know that's the thing with Alzheimer's too. When people have
Right.
Alzheimer's, they have those automatic responses that they
Mhm.
hold on to for longer than they hold on to the understanding what your words are. And with hearing loss,
Right, with
sometimes
hearing loss.
that's the case too, where you're doing those automatic responses even though you don't really
Mhm.
hear what's going on around you.
So pay attention to those answers. That just didn't quite make sense. Did you actually hear me when I said this? And then try to be polite about it. And he's like, oh, maybe I didn't hear you correctly, or something like that. And I think now that we've talked about it, he feels a little more comfortable if I ask, did you hear what we said? And I'll talk to my girls and I'll say, make sure that you're speaking a little slower, a little louder, and just directly to him, so that you can interact in a conversation a lot better.
Right. And realize how difficult it is to have the energy after taking care of someone and worrying about someone with Alzheimer's to do some of the day-to-day things and help out in those areas where you can.
And then, I'll probably call him if I haven't talked to him. I might skip a day just so I don't sound like I'm checking up on him all the time, but usually if it's 2 days or 3 days is about as long as I can go.
Right.
And even if I'm really busy, I'll put my AirPods in and I'll be cooking some food for the family, and I'll just call him up and say, hey, what's going on, and just check in with him. And sometimes it's a short conversation, sometimes it's a long conversation. Sometimes he tells me about the news, and
Right.
most of the time he will tell us about the folks he met on Meals on Wheels, and there's just some fantastic stories and cool things that I've just discovered with these same people that I'm super excited about. They've invited us over, and there's this really cool vintage musical instrument that this one family found, and I'm super excited to see that, because that's a very cool story
The one about the guitar?
about the guitar.
Yeah.
So can't wait to see that. They invited us over. So.
So now we're at a point where we have to think about how can we take care of him without mom and without this big part of his day that was, I don't know if taken up is the right word, but part of his day was taken up every day going and seeing mom and
His whole day.
and caring for mom. And he kind of planned his day around that, so right now he's pretty lost. He doesn't know what to do with his days. I think he's doing a lot of wandering around in his yard and doing some yard work and looking around his house and seeing some things that, you know, he has been putting off, but he's still having some trouble actually kind of doing them, but.
Actually, I'm kind of proud of him. I'm proud of him in the fact that I think he's handling this better than I anticipated. You know, he calls me, he's
Right.
calling you,
Yep,
he's still
calling me.
engaged,
He's still
he's still
engaged.
in community with the Meals on Wheels people. They were all so nice, and all the family members, or not the family members, all his neighborhood.
Yes.
He likes to just stand out sometimes on the driveway, and he'll see the dogs. There's a lot of people who just walk around the yard, and not the yard. I'm sorry.
The neighborhood.
Yeah, there's a lot
With
of people
their
who walk
dogs
around
and
the
their
neighborhood
kids.
and the dogs
Yes.
and their kids, and he will wave to them, and they'll say hi, and he knows several of the neighbors by name, and his next door neighbors are fantastic, and I had an opportunity to meet a few of them and have some conversations recently, and it's just really assuring that he lives in a good neighborhood. I know that might not happen for everybody, but you know, just
They look out for each other.
and there's like a network. I think
Yeah.
I think their website, their webpage, which he's not on because he's not into all that stuff, but you know, they all know, and people that he might have seen walking around that weren't quite interacted with him before would come over and just say, "Hey, we heard about your loss. We are so sorry, and what can we
Right.
do to help?" And
So many people.
it's just really cool to see everybody rallying for him and to him, and he's accepting of it, which, you know,
Right.
I wasn't sure which way he was going to go, you know. And before we, you know, approach what's he going to do now, a huge thing was how are we going to deal with the loss of our mom when it actually happened, and that was so tough, even though we knew it was coming, and it was just, we could see it, and it was just days away. Nobody got any sleep. Everybody was awake, just waiting for this phone call for 3 or 4 days. And then when it happened, it was just like, you know, at one
You're
point
never ready.
you want to. At one point, you want to think it's a relief, but the second part is like, it's done, and there's nothing I can do to help. You know, try to fix it, and that's what I wanted to do. You know, try to help cure her the best I could. And I know he wanted the best for her, and now he's at a loss because there's nothing he can do, and it's out of his hands. So what, you know, I was worried about that because now some of the things he says, and he's dealing with all the metaphysical ideas of where is she now, and what's the spirit like, and is it, am I next, and that kind of stuff. It's just really interesting to think and to put all these thoughts into his head and into our heads, you know, just to think about, yeah, this is real, and this was, you know, you sign up from the beginning, and you know the end is going to be that at some point. Unfortunately, it was, you know, the dementia, and it was just a real struggle for probably 5, 6, 7 years
Right.
of this, and that's not really what you would hope for, but you know, he stood up and was right there with her and loved her, and
Yep.
you know, he struggled with understanding why that was happening to her, such a wonderful person, and then understanding why she didn't seem to know him or could respond with him being confident that she knew him. I think that was the hardest part, because nobody ever really knows. You know, she seemed to have regressed to a 10 to 12-year-old. And so all these concepts were going through his head, and just he's trying to struggle them and reconcile all those things. And it takes some time. You've got to give them some grieving
Right.
time.
He's going to need some time to grieve for sure.
And I think for us,
And-
we have to recognize when is when should we start trying a little bit more to get them out there and engage the rest of the world a little bit more,
Right.
and try to be happy again. I think that's a real struggle. How can you make him happy again?
Well, I don't think we can make people happy, but how can we help it?
Semantics.
Right.
But yeah.
And I think that, that brings up the point of how much Mom's death has stirred up all of those losses that we encountered over the past 5 to 7 years. When we first couldn't really communicate with her, or when she didn't recognize us, or when she didn't recognize him. And all of those losses that when she couldn't dress herself anymore, when she couldn't take herself to the bathroom anymore, all those times we just lost more and more of her each time. And I think, when she died, it was like, wow, we're not gonna get her back. We're
There's
not
always
gonna,
that hope that
right.
something was going to
There's
turn
some
around.
little hope, right. Even though that's not how Alzheimer's works, right? So yeah, there was this little hope that maybe someday we'll go to visit her and she'll be lucid and she'll know who we are and we can actually have a talk like we used to have, and her passing is just like, wow, that's not going to happen, and I really wish I could talk to her again. And
Yeah.
I'm sure that's 100 times worse for Dad, right?
You had that conversation. I mean, we've talked about all the things I've been doing research-wise and with sound therapy and all that stuff, but you talked about a conversation you had with one of the leadership there at her facility and how she had struggled with one of her sons, and she saw
His
the
decline.
milestones and the
Right.
decline,
Right.
and knew these things happen right before death occurs, right? So, and it was something you said, and it was like, oh yeah, he might have a really good day, and
Right.
and it might be like the best day ever, and then the next day or two might be gone. But I was sort of waiting for that.
I know, right?
And it wasn't. And it was just, we did have a really good day.
We did.
We talked about that really good day, and that might have been the really good day. I think on a couple episodes, last episode or the one
Right.
before that, we had a really good day, and I was very excited. I was really hoping
Right.
we had made a breakthrough, but maybe that was our good day, and then after that,
And right.
there wasn't much else we could do.
And we should really set that kind of aside for a future episode of talking about our mom's last few weeks, because I think that would be helpful. I wish I would have known some of the things to expect.
Yeah.
I think that would have been helpful, even if it wouldn't have quite made it easier, because I don't know that anything could make it easier, but it would have been a little helpful to.
Yeah.
I kind of was through some of it with my father-in-law, but I think it would have been a little helpful to kind of know what's going on. So we will definitely set some of those things aside for a future episode.
Yeah, that's a good idea.
We might want to wrap this one up.
The time?
It's about
Yeah, we're
time.
going on, aren't we?
Yeah,
Sorry, it's all in our head, and we've got a lot to talk about. So,
we have a lot to talk about.
yeah, so keep an eye out on your, as you are a caregiver for the caregiver of.
Right. If you are a supportive family
Mm-hmm.
member for one of your parents or someone else that you know who's taking care of someone with Alzheimer's, look out for them too.
Be patient, be understanding, try to think and approach a scenario that seems like it looks like a bad situation, but try to take it from a different perspective, and just, if you can give love into that situation, that will probably be the best thing you can do.
Because this stuff's hard, as many of you will already know.
Yeah. We're here. We'll be here next week. And I think pretty soon we'll talk about Mom and as we said goodbye and the stages that led up to that. And I think, some of you may not be so far down the journey as we have been. So I think it would be interesting to talk a little bit more about what can you do now to try to stave it off for as much as you can. So I've done a lot of research, and I'm working on putting a lot of those concepts together. So maybe we'll put sort of a guide out there, and with links and suggestions. Nothing worked, obviously, we lost her, so, but it did make a difference along the way, and I was really encouraged by that. So
We'll talk more
resources, yeah, resources and alternatives to care. So I'll stop talking. I'm getting a kick underneath the table, but
I did not
I know,
kick
I'm
you.
just kidding. But thank you for listening. Hopefully we shared something with you that you can benefit from.
Yes, and thanks for hanging on out there while we were grieving.
Yeah. So we're there for you. Take care, and we'll see you next time on Steve and Diane on Alzheimer's.
Thank you.
Bye-bye.